Good afternoon, everyone. I'm Fátima Brañas from Spain, and the work I'm going to present is the following: Needs and involvement of HIV specialists and geriatricians in the care of older adults with HIV, a national survey. Half of the people with HIV are currently older adults. Comorbidity, frailty, and geriatric syndromes are prevalent and appear at an early age. 1 in 4 have frailty and/or geriatric syndromes without a significant burden of comorbidity, so they are in fact geriatric patients. Our aim was to test the knowledge and involvement of geriatricians in the management of all the adults with HIV and the HIV specialists' attitude towards a joint approach to these patients. We developed a survey with 12 specific questions for geriatricians and another one for HIV specialists. The surveys were distributed during 1 week last March through the national scientific societies. They were completed anonymously and voluntarily by 94 geriatricians and 63 HIV specialists. These first 3 questions assess geriatricians' knowledge of some of the peculiarities of older people with HIV that are important to keep in mind. At what age is a person with HIV considered older? You can see that more than half of the geriatricians said 65 years old. What percentage of the total number of people with HIV in the world are older? The most frequent answer was 20 to 30%. And in another person with HIV on antiretroviral therapy with good virologic control, what has more impact on his/her survival, HIV status or frailty? And more than 90% of the geriatricians answered frailty. The right answer is highlighted by a square. If the answer is mostly wrong, the square is red, and if it's mostly right, the square is green. Next questions for geriatricians. How many patients with HIV have you had professional contact with in the last year? Inpatients, outpatients, emergency department? You can see that more than 85% say 0 or 1. And how do you feel evaluating patients with HIV? You can see that 71.2% of the geriatricians would feel uncomfortable if they had to evaluate a patient with HIV. This question is intended for HIV specialists. The European AIDS Clinical Society 2021 guidelines recommend frailty screening for all people 50 or over at diagnosis and once a year. Does this seem relevant to you? As you can see on the left, more than 90% of the HIV specialists said yes. And have you incorporated frailty screening into your clinical practice? 23.8% replied yes. 47% replied no, I don't have time. But what I want to highlight is that close to 20% say no, I don't know how to do it, or no, because if it's positive, I don't know what to do. Now, I show you the same question for geriatricians on the left and HIV specialists on the right. Do you think that a change in the model of care for older adults with HIV should be considered? And as you can see, both groups mostly agreed that the approach to these patients should be multidisciplinary. Do you think that geriatricians should collaborate in the multidisciplinary approach to all the people with HIV? And you can see that more than half of the geriatricians said yes in selected cases, and more than 70% of HIV specialists believed that geriatricians should be involved in the management of older adults with HIV. And what do you think should be the criteria for referring a person with HIV to a geriatrician's office for a comprehensive geriatric assessment? Both groups agreed that the criteria to refer an older adult with HIV for a comprehensive geriatric assessment should be the presence of frailty and or other geriatric syndromes rather than the chronological age. Two different questions, one for geriatricians and the other one for HIV specialists, but both are in the same way. Do you think geriatricians have the necessary training to participate in the care of all the patients with HIV? And near 100% say no. We would need to know the particularities of other people with HIV. And do you think it is necessary for all professionals working with people with HIV to receive training for early detection of geriatric syndromes? And more than 80% of HIV specialists say yes. So both groups agreed that a specific training is needed. So our conclusions are that geriatricians have a lack of knowledge about older adults with HIV and are not involved in their management in their real life yet, that HIV specialists are open to co-management of older HIV patients, and that a specific training is needed to ensure the best approach to all the patients with HIV. Thank you very much.